as of this morning, I put out a report which stated that there were 97 cases, confirmed cases in a total in the town of Bourne. That has increased to 98 by the end of the day. And also in Barnstable County, it's up to 672. So that's where we're standing, and we are cautiously optimistic of those figures. Additionally, there's a lot of new information that's available for the public to use to get the most up-to-date information. So there's links provided on our webpage for them, and mostly they stem from the Department of Public Health web pages. So there's a new Department of Public Health dashboard, which really breaks down. It's a 23-page report. I hope that you all have had an opportunity to take a look at it and see all the different demographics that are provided in these reports. And it's a lot of statistics and data that residents have been looking for. So that's all available online. It was released as of yesterday, and it has been, again, updated today. There's also a NEMA online dashboard that has additional information, and the COVID-19 Community Alert Heat Map System, which was implemented last week. So these are really good resources for everyone to get really current information on case counts, new cases, demographics, and the like. So hopefully everyone has had an opportunity to take a look at that. And again, it's all on mass.gov/COVID-19. It's also on our Town of Bourne website. So those are some current changes. Today, the governor announced that online learning is going to continue to the end of the school year, which one of the big announcements. So that has been extended for the school systems throughout the Commonwealth. And another question that I get all the time is regarding contact tracing. So the CTC, the Community Tracing Collaborative, we've had a lot of work going on to see how that's going to be implemented. And we have opted in the town of Bourne to do so. We are lucky to have the Visiting Nurses Association, who's providing our communicable disease follow-up. So that will be deployed, and you can opt in and select to do so. And that is going to be rolling out throughout the Commonwealth and kind of taking priority. We can choose if there is a language barrier or if there are more than a dozen contacts linked to a particular case. That's mostly when we'll be utilizing that right now because we're in pretty good shape using the VNA. So that's something I get asked about a lot. And if anyone has any questions, if they're clinically diagnosed or if they have questions, if they have been contacted saying that they had an exposure to COVID, give us a call at the local Board of Health 7 days a week, and we'll refer you to the appropriate public health nurses and be able to assist you. And it's good to know if there are cases which may not be within MAVEN, our electronic disease surveillance system. It's good to know this so we can do additional follow-up on them. So we'd appreciate anyone reaching out with any questions, and we're happy to help in any way that we can. So if anyone has any questions.
Do you have any AmeriCorps or any volunteers that you can access to help take some of your stress away?
We contract with the Visiting Nurses Association of Cape Cod, who's a division of Cape Cod Healthcare, and they have hired additional personnel. There's also some volunteers that are available through the state and the CTC, this Community Tracing Collaborative. It's essentially no cost to the town. These are all reimbursable expenses under the governor's orders and the emergency orders. So we are, I say this with caution, we're in pretty good shape as far as that goes. And so we're utilizing all resources as they're available when we need them, certainly.
Yes, Terri, I'm a little bit concerned about the changing relevant data as we venture further into this this crisis. And I'm just wondering, are you satisfied that there's consistency, not just within the town of Bourne, but the information that Bourne is feeding to the state, or the state is extracting from the town going forth? I know that things like nursing homes are now termed as hotspots, and I think as long as the information that we're giving them is just there's consistency within that those key metrics.
Public health officials, healthcare, and approved laboratories are all using the same framework for disease surveillance. So we are linked into that. There may be a lag in some of the reporting. The hospital may know it first, the laboratory may know it, or vice versa. So there's certainly the possibility for a little bit of lag in reporting. And that's why some metrics are reported on a weekly basis versus a daily basis. Ultimately, it should all be consistent, but you can anticipate that there is a little bit of margin for error in reporting and being able to generate all this information, produce it back out to the public. It takes a lot of work, so we're lucky to have the reporting that we have now.
Wanted to thank Terri for joining our meeting. I think that it's really critical that, you know, we have that interdisciplinary function with the Board of Health here and the health department right now. I think that it's key. I think the residents are looking for that kind of unified approach, so this is perfect. I did have a comment or maybe a question. So it's great that the state has released the data that it has to the town, so now we have individual numbers by town. I did see that Boston was going to start tracking by neighborhood and zip code, and I imagine that they have resources to do that. Do you think the numbers that we get from the state now will probably be the numbers, not the actual digits, but the way that the information is released going forward? Or do you see even a further breakdown moving forward? That seems very specific to neighborhoods and zip codes, but I just didn't want the public to be unclear about how we were going to be able to disperse this information.
There is the COVID-19 Community Alert Heat Map system that was released last week, collaboration through Cape Cod Healthcare, Cape Cod Commission, and the Barnstable County Department of Health and Environment. And there was a data layer on there which breaks down per zip code. When that was first in conversations, there were so many questions, concerns about the villages we have and even fewer zip codes, but I think it's about 6 or so. And some extend to different villages and even different counties, both sides of the bridges too. So there were a lot of questions and concern about how that data would be represented and if it would be accurate. So at that time, we're not featured specifically on that data layer. We could be in the future if we get some clarification on how that will work out. Specific neighborhoods would be a concern in a small type community such as Bourne, because that's potentially identifying to certain individuals. And City of Boston would be a slightly different public health practice because one neighborhood would probably have a 10-fold higher population than here's locally. So it's all a work in progress, and we're kind of taking it day by day. I think the data will be rolled out in a pretty consistent format, and there'll be changes implemented along to supplement what we haven't really got out yet, certain demographics and things like that, but of course protecting the privacy of our patients. So
I know that there have been questions about the use that mandating people wearing masks and mandating the number of people who can actually go into a store. Can you talk about that just a little bit for the public?
Absolutely. Yeah, I'm happy to answer that. Those are frequent questions that we're receiving. So the CDC had put out a face covering advisory to wear a cloth mask, and the state implemented the same on April 10th, which is a face covering. So this is a cloth mask. If you do not have one that's been made, it could be a bandana, a scarf, or equivalent that covers your nose and mouth tightly. And it's a source protection. So public health premise there is that an asymptomatic person could be potentially, carrying or spreading. And this is best practice if it's in a situation where you can't really practice social distancing. Social distancing would be key when you're in these public places, or just staying at home for non-essential errands and things like that. But if you're going out and doing essential errands, it is an advisory and it's a strong recommendation. It is not mandatory. We understand that some people do not have it. We've expressed the significance of this advisory to all of our food establishments and, through all of the businesses which we license under the Board of Health. And I think everyone's really doing the best that they can. But as residents, the key message is really to follow those governor's orders and to stay home if you can. If you have essential errands to run, to take the public health precautions and wear a face covering or equivalent if you're going out and you're not quite sure if there's going to be an ability to practice appropriate social distancing in those settings. So,
Terri, I'm a little concerned that everyone seems to be stuck on the numbers, and you can correct me if I'm wrong. The numbers is a part of documentation for all of this, but it seems that people are really looking for these numbers to make their own assessments and use their own assessments to go forward in their day-to-day activities, as opposed to waiting for decisions made by health officials like yourself in town and state governments. It concerns me that some people are going to look at these numbers, and there's a greater experience and collection of data otherwise that help make up that decision for officials to keep everyone home safe rather than out and going about. I just kind of fear that people are going to take those numbers and use them in their own assessment.
I agree that it is a concern, and I'm sure that other public health officials are concerned too, that if you see a low count, that maybe you'll feel as if you're safe. Or if you see a high count, then maybe you're neglecting certain essential errands that you need to take care of yourself and the health of your family. But really the guidance from the state and your local officials are what you need to be going to, and really focusing on what's essential, taking care of yourselves, your friends, your family, and your neighbors, and not taking the data and statistics anything other than this is the best information that we can give you right now. But ultimately, everyone needs to take care and stay healthy, stay home and stay healthy to the best of their abilities, so that we can get back to normal as soon as possible, really.
Jared, to that point, I watched the data and I watched you come in, and I think we've all heard about flattening out the curve, and we're all looking for those down slopes. But I do want to caution folks, because if you do look at the data, there already has been a peak, and I want to say it was on maybe April 10th. We actually had a down slope. Then it peaked back up around April 16th. And I know we're on a down slope right now, but again, I know the governor's being very cautious about this. I think he's rightfully so. You just don't really know right now which way that slope is going to go, whether it's going to go back up or it's going to continue on a downward trend. Today, also, the governor, he did talk about watching the number of people who are hospitalized because of COVID-19. And that's a true indicator, he believes, of where we're going right now. And that number continues to go up. You don't see that number reported in the press. I don't know how readily available it is, but it's one of those key indicators that people like Terri and ourselves really need to look for before we make a determination onto which direction we're going.
I think it's important for everyone to take note of one number, and that number is the number of deaths. Take that to heart and understand that there are a lot of people mourning their losses, and I think that's the biggest number we should take home with us.
It's true, and all of the conversation about people being carriers of the virus, and I think it seems like we should all believe that we are carrying it, and so we have to be careful and be kind to other people as we're going. Terri?
And I just want to follow up on Glenn, so the information that you mentioned, so that it's probably hard to see here. So the dashboard link that I provide on the website, it does show the case counts by hospitalization rates, and it's all updated daily. This is literally 23 pages of data and statistics, and it's pretty relevant as far as what you were just saying, Glenn, how they can be indicators of the status, and you can interpret them in many different ways, but they've provided through the Office of Population Health and the Bureau of Infectious Disease and Laboratory Sciences. It's really good, and this is 23 pages, which is all just statistics and data that is updated. So I know it's a lot, but it's in line with what the governor was discussing earlier today.
What Terry mentioned, that, the governor spoke about today, that, the 2 or 3 day, sort of decrease, we saw is not considered a trend. He mentioned last week about, looking for almost a 2-week consistent decline in a variety of different, numbers. But I think we're, everybody doing the right thing is, we're seeing a positive trend. We just got to, make sure we continue to do the right thing until it really falls off.
Thank you very much.